I would say probably one of the biggest updates in the diabetes guidelines over the past maybe 4 to 6 years is really the impact of two drug classes on other comorbidities. So the GLP-1 agonist and the um, SGLT2 inhibitors are two drug classes that now have data to support their use for diabetes patients with other comorbidities. But they also have data to support their use for other comorbidities in general. So, in terms of managing patients who have heart disease along with diabetes or have heart failure or chronic kidney disease, this has been a really big update and a big piece, and I think a way that pharmacists can be helpful in comprehensive care.
So knowing that our GLP-1 agonists really have a variety of benefits, we just talked about their use for cardiovascular disease and preventing chronic kidney disease progression. And so it's really just another kind of add-on benefit when you talk about using these medications as part of the tools for patients and their weight loss. There always is going to be challenges with cost. There's going to be challenges with adherence and concerns about injections and the stigma that comes along with those medications and some of those other spaces. But we always can work from the pharmacy side to help patients understand why this is beneficial, why they might benefit from the medication beyond just weight loss, and also things that we can support in the pharmacy. So things like DSMES and DPP programs to help also support that weight loss from the more lifestyle modifications, which is really also what the guidelines plug as well, is it's not just about medications, it's medications and lifestyle. And so we can really help be that kind of wraparound approach.
Yeah, I think there's a few things. Diabetes technology has grown tremendously, just even over the past few years. And I think, we as pharmacists are very used to working with patients who have been using a glucose meter for a long time. Um, I think pharmacists do a great job at being up to speed on technology and understanding some of the new continuous glucose monitors that are available. But we are also, I think, the healthcare professional that provides a lot of the education. So a lot of times the patient is coming to us having experience with a glucose meter, but they have questions about CGM. And so as the pharmacist, we can be really impactful in first learning how to use that technology ourselves, but then making sure that it's a right fit for the patient long term.
Yeah, data is really powerful, but it's important to recognize a couple of things. So alert fatigue is real. If that CGM is going off all the time, it just becomes background noise and patients aren't going to plug into it and really appreciate what those alerts are trying to tell them. I think it's also important to know from your patient perspective, do they want more or less information and what are they going to do about it? And so if it is a patient that is going to really dive into, I'm going to keep a food log and I'm going to see exactly what those foods do to my numbers. And that's really great. Give them a lot of data. If they're going to become really kind of fixated on the numbers and feeling like a measure about their own, progress, if they just have one episode of hyperglycemia, then maybe we have to scale back those alerts. So I think it's really important to kind of figure out what is most beneficial for the patient and helping them to manage their own disease because they really are the biggest player in that, but also to kind of scale back to what is most important. So for a lot of times, hypoglycemia is our biggest concern. And so what can we do to just set up those alerts to get started if that's our biggest problem, and then kind of expand as we start to see more of that time in range, meaning we're going to see less alerts overall, and we can start to pull in some of those smaller alerts to bring in kind of a bigger picture. I think this is when you got to meet the patient where they are. So if the
Yes.
patient doesn't have a smartphone, we can't pick a product that only interacts with smartphones. And if they need a product that has a standalone reader because they don't have like the access for technology, we have to support them in doing that. And I think it's also important to remember that CGMs can be a more transient tool as well. We can use them for a couple weeks to gather that data and then maybe transition patients back to just their glucometer if that's what's going to fit best for them, instead of adding something of greater complexity that really becomes more of a stress and less of a helpful tool to them.
I think pharmacists are well equipped to help people personalize what they need. A lot of times patients may come to us and maybe they've seen something on television, or they have a friend or family member that's, wearing a CGM, they want to learn about it. But we can really sit down with that person and figure out what their needs are, what their technology capability is, and design a plan that fits them.
You have two pharmacists that are really on the opposite ends of the prescribing and dispensing. So I primarily work in academia, but my clinical practice site is still dispensing. And so I am on the receiving end of the prescriptions and the insurance navigation, helping patients to afford the medications, pick them up at the pharmacy counter. So from that perspective, I always try to stay very updated on like, okay, is this actually not covered, or do we need a special diagnosis code, or what is like the Medicare requirements for CGMs, because those are always new and evolving. And there have been some really unique challenges I've encountered where I had a patient in the past that their sensors were not covered because there was no reader ever being billed to Medicare. They were using their smartphone, they had a reader, but because Medicare did not have a reader billed on file, they wouldn't cover the sensor. So kind of figuring out those nuances and being the advocate to help with coverage. So that's like the role that I try to play, is like making sure that we overcome a lot of the financial concerns, and then also making sure patients understand when they have that product in their hand, what do you do with it?
From my perspective, I am also in academia, but my practice site is in a family medicine primary care office. So a lot of times I am, working with both the prescriber and with the patient. We have a lot of newer prescribers, medical residents who aren't very familiar with diabetes technology. They want to work with their patients as well. And so I'm doing some education on that end to make sure that the people that are prescribing it understand, how to make sure it's the right fit. I also tend to do a lot of the prior authorizations in our office. So from the financial aspect, but in a little bit of a different flavor. And then lastly, patient education. A lot of times when people are coming into the office to see their primary care physician, diabetes is part of what we're going to address, but they have many other concerns. And so if I can spend maybe 10 or 15 minutes with them after they see the physician to do some diabetes education and planning, that can have a real positive impact. I mean, I would say, in thinking about the ADA standards of care, I think all pharmacists have an opportunity to impact, patient care across the lifespan. But I think also sometimes when we think about diabetes guidelines, we think about pharmacotherapy. And that, of course, is a very important part of it. But the ADA standards also talk a lot about the management of comorbidities, lifestyle, social determinants of health, technology. It's a really, really comprehensive document. And so I would just encourage any pharmacist that's out there that hasn't taken a look at some of the summary of that document, to take some time to do it, because again, you're interacting with diabetes patients all throughout the lifespan and in any setting that you practice.